2010 is the 10th anniversary of the Gates Awards, and I'm here with Peter Ngatia, who's the director for AMREF. Peter, thank you for joining us on Global Health TV. So Peter, AMREF won the award in 2005. What did you do with the money?
Many things, great things as far as health and health development in Africa is concerned. When we won the Gates money, the $1 million, we increased our research component of AMREF. We increased the funding that goes to health systems strengthening. We increased funding on areas of the strategy like community partnering that were not being done. So all in all, the AMREF program grew.
So what impact has that had? What are the results?
Expansion of programs to poor communities, communities that we could not reach before were reached. Women and children who could not have services, today have services because we were able to deliver those services to them. So in places like Southern Sudan, we have set up training of community midwives. We have set up training of clinical officers, and these are the providers of health services within those communities. They are not doctors or nurses. So as a result, our communities are getting the services from these AMREF trained health workers. But beyond the $1 million is the reputation that came with it. Many other donors came on board. So the AMREF budget actually grew almost by another 20–25%.
So as you say, winning the award created a lot of press and publicity around AMREF. What effect did that have?
I think we have got recognition from governments across the continent of Africa. They listen to AMREF voice when we talk about health and health-related issues. We have gotten the ear of governments like the US government, where we get quite substantial funding because I think after Gates, our name became a big name within United States. With the British government, DFID also comes in and contributes quite a huge amount of money. And all this goes to building health systems in the continent of Africa. We have expanded our program. We used to be in a few East African countries. Now we are in 6 countries of East Africa. We are expanding to West Africa because now we got the necessary funding as a result of this recognition, this reputation, to be able to move to the rest of the continent.
So you've come a long way. What are the next steps?
The next steps for AMREF is to concentrate, to focus more on maternal and child health, because we believe this is where the problem is. And if you can tackle maternal and child health, you have tackled the huge issues of the health system, because the mother, the child are the 80% consumers of health services. We are going to invest in human resources for health, the health workers. The shortage of health workers in Africa is a huge, huge problem. And unless we have adequate health workers who are sufficiently trained, we are not going to meet the Millennium Development Goals. So this is important that the future will be looking at the Millennium Development Goals, particularly 4, 5, and 6. 4 because of the children mortalities, 5th because of the maternal mortality, and 6 because of HIV/AIDS, malaria, and TB.
Well, Peter, that's all we've got time for, but thank you very much for joining us on Global Health TV.